So first of all, thank you so much to all doctors. A very good evening to all the NIMN doctors. Thank you so much for joining for us for today webinar. Our endeavor is to spread awareness about rabies, which is fatal but can be avoided once appropriately vaccinated. This is an innovated from Cadila Pharma. Through it, innovation to serve the society, human and humankind. The topic of the webinar is doses reduction strategy in rabies management, role of naval vaccine. Dear doctor, rabies is the world's first naval three-dose anti-rabies vaccine with great pride. We would like to inform you that rabies has successfully completed 1 year of launch, with more than 60K animal bite victims being vaccinated. 100% compliance was recorded, and number of cases ADRS was registered. With this, it is my honor to introduce you to our speaker, respected Dr. Today webinars, Dr. Manish Laskari sir, MD Medicine. This is Dr. Sahib is director of Laskari Hospital, 26 year in Betul, leading Laskari hospitals. So now I would like to Dr. Manish Laskari sir to indicate the term, and later to on will have question and answer session. All the participants can drop their questions in the drop box, and will read out all the questions after presentation. So thank you so much, sir. Please start presentation.
Thank you, Mr. Santosh, and thank you, Team Cadila, for inviting me to speak on this very important topic, that is rabies and prevention of rabies by means of this novel discovery by Cadila Pharmaceuticals in form of G protein vaccine, which is known as PH rabies. As you all know, that rabies is a very important public health challenge in India. Globally, 59,000 human deaths occurs annually in India because of rabies, which is highest. India has got 20,000 human deaths in a year from rabies, accounting for 60% of rabies deaths in Asia, 35% deaths globally. And this is very important fact that 91% deaths of rabies occurs in India in rural areas. I think because of availability of vaccines and ignorance of the patients. And in India or globally, every 9 minutes, one person dies because of rabies. So, what is the current management of rabies? If you see, so there are 3 stages of management of rabies. First is local wound treatment. Local wound treatment is done by means of aggressive and vigorous washing of the wound site. That is for 15 minutes. Running tap water is poured onto the site of wound, site of bite on the wound, and it is rubbed thoroughly with soap, water, and disinfectant. And after this, we go for active immunization. There is vaccination. And if the bite is more than category 2 or 3, that is blood is present, then we also give passive immunization, that is rabies immunoglobulin. Since ages, there were 5 doses of intramuscular regimes in India after the bite of animal or active immunization that were on the days of 0, 3, 7, 14, and 28, and rabies immunoglobulin on day 0 in cases of category 2 or category 3 exposure bites. These vaccines are normally injected in intramuscular by intramuscular method in deltoid upper arm area or anterolateral aspect of thigh. They are never injected in luteal area because there is poor blood absorption in luteal area and the vaccine efficacy might reduce. So, what are the current challenges of treatment of rabies by means of post-exposure prophylaxis? Number one is non-compliance. Because of 5 doses of vaccines, many people forget to complete their rabies vaccination schedule and patient becomes non-compliant. Secondly, the current rabies vaccines which are available, they are cell culture vaccines, CCVs. And this is inactivated 50-year-old technology and the potency is inconsistent. The stability is also inconsistent. Sometimes they are in short supply and they are not available very freely. Also, some side effects have been observed with the traditional vaccines which are available, that is cell culture vaccines. So compliance is a very important part in the management of rabies and post-exposure prophylaxis. Patients who receive full course of ARV, which is scheduled as per the category of bite, this is called compliance. Delayed compliance, the patients who completed scheduled dose of ARV within 60 days but deviated from the scheduled regime. Patient although completed, they have not followed the schedule regime which is prescribed. And the third is non-compliant or dropout category. Patients who had taken at least 1 dose of ARV after animal bite but did not complete the complete course of 5 doses. This is non-compliant or dropout patients. So if we see this busy chart, then we can conclude that the reason of deaths may be due to lack of administration of rabies vaccines or immunoglobulin or poor compliance of vaccination. So whenever there is some casualty with the rabies vaccination or not rabies vaccination, but because of dog bite or animal bite, then in most of the cases there were issues of poor compliance. Either patient did not complete the complete schedule of post-exposure vaccination, or patient did not take passive immunization by means of rabies immunoglobulin. So poor compliance and lack of administration of rabies immunoglobulin were the major causes of death of patients in dog bites. A study was done at Safdarjung Hospital in New Delhi, in which 360 animal bite patients were studied. It was a pre-designed, pre-tested, structured questionnaire was administered by the internet technique, and it was found that 53% patients were non-compliant to the full courses of rabies vaccination. This is a huge number. And the compliance rate for the intravascular rabies vaccination, which was done at again some municipal corporation hospital Bangalore, it was found that above 60% of patients were non-compliant with these older regimes. So, what is the cause of non-compliance? If we see, so there are certain causes of non-compliance. 11% of patients found that it interfered with the school timing. 11% patients found that hospital was too far from their home. Some patients, 13% patients, that rabies vaccines are costly. Some patients forgotten the dates of rabies vaccination, and some patients felt that if they go for vaccination, they will lose their wages. So these were some important causes of rabies vaccination. Now, if we see the history of evolution of rabies vaccination, then it started way back in 1885, where first live attenuated vaccine, spell cord, derived from spell cord, was derived. It was a non-sterilized dried preparation. 31 injections of increasing immunity had to be prescribed to save patients from animal bite consequences. So it was a nervous tissue vaccine. Then some discovery happened, and in 1911, inactivated nervous tissue vaccine came into practice, and that they had got minimal neural content and their liquid preparation and 14 injections required, each 5.5 ml daily. Then in 1976, cell culture vaccine, that is CCV, they were inactivated vaccines, more than 2.5 interstitial units, and they were following 5 injection regime. That was 0, 3, 7, 14, and 28 days. And the standard dose was 0.5 to 1 ml. So this is the current regime which is being followed in most of the places in India. And this is the major cause of non-compliance. 31 injections were literally impracticable. 14 injections were also impractical and very painful. Again, patients are taking 5 doses, but sometimes they forget to take complete 5 doses and they become non-compliant. So, what is the solution of this non-compliance of these anti-rabies vaccination? So, Cadila Pharmaceuticals have come up with a very novel vaccine, which is a G protein vaccine, and it is meeting the unmet needs of medical fraternity and giving a short course of post-exposure prophylaxis vaccination. So they have introduced a simple and shorter regime for management of rabies by means of post-exposure prophylaxis. So this is a novel 3 doses recombinant rabies G protein vaccine. This is the first protein subunit vaccine. It is prepared by VLP platform technology. First vaccine 3 doses. It is intravascular in station. The compliance is very better due to easy pro regime and less visits. This is very convenient to use. It's ready to use and no reconstitution is required. So users of the headache of paramedical staff is also minimized and error caused by paramedical staff is also minimized. So now, what is VLP technology? VLP, when the native virus is treated with G protein, is difficult to stabilize. G protein isolation is done using VLP technology. It is purified and dispensed by Cadila Pharma. Virus-like proteins, whereas VLP are protein complex is nanoparticles. Virus-like proteins are similar to native virus particles, but they do not contain the viral genome. They cannot replicate, but can meet the viral antigenicity without being pathogenic. So they are capable of producing a short, strong humoral and cellular immune response. So VLPs are vaccines. So basically, these G protein are VLPs, virus-like proteins, but they are inactivated virus, and hence they are not pathogenic and not virulent, and do not cause any harm. But they induce a strong humoral and cellular immune response. The safety and immunogenicity of this novel 3-dose recombinant nanoparticle rabies G protein vaccine administered as a simulated post-exposure immunization was performed in a randomized controlled trial, and immunity and safety of this vaccine was evaluated. A regime was given on 0, 3, and 7 days. Efficacy and safety were observed, and it was found that this novel 3-dose has better safety profile and as compared to CCVs, cell culture vaccines. So the conclusion of the study was that novel 3-dose vaccine was non-inferior to reference vaccine. It has got less adverse effects compared to reference vaccine, and this novel 3-dose vaccine was found to be safe and immunogenic and comparable to 5 doses of WHO pre-qualified vaccine. So because of its excellent innovation by Cadila Pharma, this was awarded with Pharma Innovation of the Year by Economic Times and the Golden Globe Tiger Awards, Malaysia for Innovative Product of the Year is received. So in short, we can say that this novel VLP virus-like protein, which is a G protein vaccine introduced by Cadila by the name of TH rabies, is very, very effective, safe, compliant, has less virulence, and has got strong humoral and cell-mediated immune response. And this is excellent happening in the medical field in terms of rabies treatment by means of post-exposure prophylaxis. Only 3-dose schedules required: intravascular or retide or antiviral 5 on day 0, day 3, and day 7. I thank you all for your patient listening. And if there are any questions, I am most welcome. They are most welcome.
Thank you so much, sir. Thank you so much, Dr. Saab, Dr. Manish Laskare, Dr. MD Medicine, for informative talk, sir. Thank you so much. We truly appreciate your efforts. Last but not the least, we would like to inform you that Ravis has won 2 prestigious award innovation category. First is ET India Pharma Award and Golden Globe Tiger Award also. Thank you so much, sir, for information to presentation. Thank you so much.
Thank you.
If,
It's my pleasure.
I request to all doctors, if any questions, so Dr. Saab is here. Please drop your questions.
I think the topic is very well understood by the audience. So there are no questions.
Doctor, a common question which comes across is like, what are the limitations of anti-rabies vaccine dose and benefits of novel 3-dose vaccine? I think that's a common question which comes across.
Yes, yes. Conventional 5 doses vaccines, that is cell culture vaccines, CCVs, have got major limitation in forms of compliance. They have to be given 5 times for all 0, 3, 7, 14, and 28 days. So most of the patients forget to take complete regimen. So this is the major issue of major reason for non-compliance of the major this vaccine. And with only 3-dose regime, that too on 0, 3, and 7 days, this novel G protein vaccine, that is TH rabies, has overcome this limitation, and compliance of the patient has got improved tremendously. Patients are now completing their whole regime conveniently and comfortably, and less and less complications are being faced these days because of this vaccination schedule, which is given by TH rabies vaccine. Compliance, safety, and efficacy, both 3 points majorly favors TH rabies, that is novel G protein vaccine.
Thank you so much, sir, for explaining us the importance of novel 3-dose vaccine, and thank you so much for sharing your thoughts about this novel 3-dose Thrabis, an innovation by Cadila Pharma. Thank you so much. Have a good night, sir.
Right. Thank you. Good night to you.
Thank you so much, sir.
Thank you.
Tech support.